Compartment Syndrome. Introduction. Compartment syndrome is a severe condition where pressure within an osteofascial compartment rises to a level that compromises perfusion, potentially leading to irreversible muscle and nerve damage. Common sites. Occurs where skeletal muscle is surrounded by fascia, most commonly leg, forearm, hand, foot, thigh, buttock, shoulder, paraspinous muscles. Etiology. Trauma, e.g., fractures, crush injuries, contusions, gunshots. Tight casts, dressings, or external wrappings. Extravasation of IV infusions. Burns. Post-ischemic swelling. Bleeding disorders. Vascular injury. Pathoanatomy. 1. Local trauma and soft tissue destruction. 2. Bleeding and edema. 3. Increased interstitial pressure. 4. Vascular occlusion. And 5. Myoneural ischemia. Compartment anatomy. Leg, 4 compartments. 1. Anterior, dorsiflexion, tibialis anterior, EHL, EDL, peroneus tertius. 2. Lateral, plantar flexion, eversion, peroneus longus, peroneus brevis. 3. Deep posterior, plantar flexion, inversion, tibialis posterior, FDL, FHL. And 4. Superficial posterior, plantar flexion, gastrocnemius, soleus, plantaris. Forearm, 3 compartments. 1. Volar. 2. Dorsal. And 3. Mobile wad, brachioradialis, ECRL, ECRB. Hand, 10 compartments. Thenar, hypothenar, adductor pollicis, dorsal interossae, 4. Volar interossae, 3. Foot, 9 compartments. Medial, lateral, interosseous, central, and others. Thigh, 3 compartments. 1. Anterior, quadriceps, sartorius. 2. Posterior, hamstrings. And 3. Medial, adductors. Clinical presentation. Pain out of proportion to the clinical situation, difficult in sedated or polytrauma patients. Severe pain with passive stretch, most sensitive sign. Paresthesia, hypoesthesia, paralysis, late sign. Tense swelling, absent peripheral pulse, late sign. Investigations. 1. X-ray to detect fractures. 2. Compartment pressure measurement. Indicated for polytrauma patients, unreliable clinical assessment, or inconclusive findings. Diagnostic thresholds. Intracompartmental pressure greater than 30 mm of mercury. Delta pressure, diastolic minus compartment, less than 30 mm of mercury. Management. Conservative treatment. Observation if intracompartmental pressure less than 30 mm of mercury. Elevation. Bivalving of casts or removal of dressings. Hyperbaric oxygen therapy. Operative management. Fasciotomy. Indications. Intracompartmental pressure greater than 30 mm of mercury. Delta pressure, diastolic minus compartment, less than 30 mm of mercury. Techniques. 1. Leg, dual incision approach. Anterolateral incision decompresses anterior and lateral compartments. Posteromedial incision decompresses deep posterior and superficial posterior compartments. 2. Forearm. Volar and dorsal incisions. 3. Hand. Longitudinal incisions targeting thenar, hypothenar, and interosseous compartments. And 4. Thigh and foot. Longitudinal incisions to decompress respective compartments. Complications. Loss of function, neurological deficit. Volkmann ischemic contracture. Infection, amputation of affected extremity.